Hi, hello guys, welcome to Rennie's Nursing Academy, Nagarkoil. Hope you all are doing good, staying safe. Today class la poradhukku munnadi subscribe பண்ணாதவங்க subscribe பண்ணிக்கோங்க, பக்கத்துல இருக்க bell icon click பண்ணிக்கோங்க, so that when uploading my next videos உங்களுக்கு notification la show ஆயிடும். So இன்னைக்கு after a long time we gonna see a classroom video regarding lumbar disc herniation பத்தி தான் பார்க்க போறோம். It is one of an important condition that will come under musculoskeletal system. Here we go. So topic பாத்தீங்கன்னா, as I told you, this is lumbar disc herniation. So same thing we are otherwise called as rupture னு சொல்றாங்க, protrusion னு சொல்றாங்க, and also we are calling this as bulging. So in other nursing diagnosis or coming to diagnosis, we are calling this as herniated disc னு சொல்றாங்க. All these lumbar disc herniation or herniated disc, everything is same. So இப்போ first let me start எங்க எந்த இடத்துல வருது அப்படினு பார்க்கலாம். Commonly it was mentioned that it can occur any places of the spine. Spineல எந்த இடத்துலனாலும் வரலாம், but the most common place எது மென்ஷன் பண்ணிருக்காங்க அப்படினா it is L4 to L5 or L5 to S1 அப்படினு சொல்லி மென்ஷன் பண்ணிருக்காங்க. So this is the most dominant or most common area this particular problem can occur. So definition பார்த்தோம்னா, this is the pain and weakness in the lower back due to the compression of sciatic nerve. So you already know that's a nerve that is passing, that is called as sciatic nerve. And also இது வேற எதுக்கெல்லாம் காமனான ரீசன் அப்படின்னு சொல்லியிருக்காங்கன்னா, for developing lower back pain, sciatica வரதுக்கும் this is one of the main common reason அப்படின்னு சொல்லியிருக்காங்க. Then we see about the symptoms. The symptoms பார்த்தீங்கன்னா, pain that is aggravating pain னு சொல்லியிருக்காங்க. இன்க்ரீஸ் ஆகுது, எங்க இன்க்ரீஸ் ஆகுது அப்படின்னு பார்த்தீங்கன்னா, it can radiate to the hip area, to the buttocks and down towards the leg, because you already know sciatica is a nerve that is crossing towards இல்லையா. So அந்த மாதிரி இடத்துல pain வந்து radiate ஆகி போகுது. So if the patient is coming and tell you the pain that is it is developing from me lumbar region, hipல இருந்து it is radiating toward my leg அப்படின்னு சொன்னா, we can have a query that it may be lumbar disc herniation சொல்லலாம். The next symptom என்ன அப்படின்னு பார்த்தீங்கன்னா, bowel and bladder dysfunction can happen. This is very important. You already know in the spine, in lumbar and sacral area, if the patient is developing any problem, they might have lost that sensation and movement in the lower area of your body. So kandipa the patient can develop bladder and bowel dysfunction. This is one of an important symptom. The next one, sciatic nerve compression. I already told you the nerve that is passing is called a sciatic nerve. So obviously sciatic nerve compression can happen. Clear? Now we see about the which thing is getting aggravated. So எந்த particular விஷயம் நம்ம பண்ணும்போது நம்மளோட symptoms, that is main symptom I already told you, that is pain. அந்த radiating pain எப்போ ரொம்ப அதிகமா ஆகுது அப்படின்னு பார்த்தீங்கன்னா, during the time of straining. This is very important. Mark it as important thing. So straining அப்படின்னு சொல்லும்போது, coughing பண்ணும்போது, so this area is getting compressed இல்லையா. So coughing, lifting of some heavy objects, so இந்த மாதிரி பண்ணும்போது, and any sudden movement of your body. So abnormal எதனாச்சும் ஒரு posture maintain பண்ணும்போது, suddenly bend பண்றது, suddenly turning like this, no. So இந்த மாதிரி பட்ட movements பண்ணும்போது this particular symptom is getting aggravated a lot. The next one is treatment. How you can treat this? So first main thing that is coming under intervention is heat application you can give. So on that particular area, when you are providing some heat application, no, they can be relieved from muscle spasm. So muscle spasm relieve பண்றதுக்காக you can give heat application. And the next important thing is you can go for pelvic traction. You already know pelvic traction is the traction we usually give for the lower areas காக தான் நம்ம நார்மலாவே pelvic traction யூஸ் பண்ணுவோம். Yes, by using this pelvic traction you can be relieved from the lower back pain that was caused by this particular condition. The next one அப்படினு பாத்தீங்கன்னா, position. This is very important. So what position you can give for this particular patient அப்படினு பாத்தீங்கன்னா, you can put the patient on left lateral போட்டு you can flex the hip and knee, and also you have to place a pillow in between the two legs. So இந்த மாதிரி position கொடுக்கும்போது they feel comfort by this. This is one of an important question. What position you can give for the patient with this particular lumbar disc herniation? So the position is left lateral, flex the knee and hip, and also you can place a pillow in between the two legs. The next is NSAID. The medical management you can go for is non-steroidal anti-inflammatory drugs for severe pain. The next important thing what they are given is glucocorticoids you can provide, because the steroid is having some anti-inflammatory effects. So this anti-inflammatory effects helps to prevent this nerve compression and swelling on that particular area. So that the steroid is helping a lot in coming out of this particular symptoms. And then finally you have to tell your patient to maintain perfect body mechanics. This is important when they are doing some particular works like bending and moving and doing something. No, you have to tell your patient to maintain a perfect body mechanism during the time of movement or anything. Now the next main management what given under this condition is surgical management. You can go for the first one is discectomy with fusion pandranga on that particular area. No, they are removing the particular bulged or protrude or ruptured disc. No, they are removing. That is called as discectomy with the fusion. And the next important surgery what they are go for is laminectomy or decompressive laminectomy. In this laminectomy, no, so there are some important complications that can occur after this particular surgery. So complication enna appdin paathona, the first one is bladder dysfunction. I already explained you previously. When you develop any problem in the lumbar or sacral region, no, automatically you will develop problem in the movement and sensation of the lower area. So kandipa bladder dysfunction varudhu. For this bladder dysfunction, you can go for a method called CRED method. So CRED method is you can give massaging on the lower uterine segment or pubic area so that the vagus nerve will get stimulated and the patient can improve that particular sensation for voiding. So the method you can use here is CRED method you can go for. Then second problem they will develop is paralytic ileus. That is, there will be absence of peristaltic movement inside the gastrointestinal area can happen. As a result, they will end up with constipation. You already know when there is no peristaltic movement, automatically they will develop constipation. And post-operative management, what are all the things I have to follow after this particular laminectomy is, first thing is they have to maintain flat position. This is very important. For the next 24 hours, no, strict bed rest has to be given to this particular type of patient. So you have to maintain flat position and minimize the time of sitting. When the patient asks you, I want to sit for a long time, I want to sit on the chair, means tell your patient not to sit on a place for a very long time, because no, when they are sitting, no, this area will get again compressed. Already we had operated there, so it may end up with some other complications. So tell your patient to avoid sitting for a long time. The next is avoid hip flexion. So hip flexion you have to avoid. Then log roll method you already know. When you maintain a flat position for your patient, the main method you will follow is log roll method during the time of shifting or moving the patient. Then morphine can be used for severe pain. You already know for post-op the patient will be in severe pain due to this particular surgery on the spine. So you can go for morphine. Then finally high fiber diet, fluids and stool softness you can use for this particular problem, constipation. You already know after this procedure the patient will develop constipation. So for this particular constipation you can go for this particular thing so that you can prevent the particular post-operative complication called constipation. Clear? So that's all about this today's class, that is lumbar disc herniation. This is one of an important topic for your nursing licensure examination. Hope this video was very useful to you all, and I will see you soon in my next upcoming classes. Stay safe. Thank you so much.